Good communication and education are key. Motivational interviewing strategies help providers find what motivates patients to change. Patients may know they need to change, but they're often ambivalent about it. Getting the patient to hear his or her own arguments for and against the change can get the patient to convince themselves and helps them find their own motivation. I'm very positive when I discuss diabetes care and lifestyle changes. I ask open ended questions to elicit that change talk. Discussing lifestyle changes, I'm sure to tell them that small changes are more likely to be successful, and even small changes can make a big impact. I provide them with the information about this beta cell workload theory, making sure that they understand the need to preserve beta cell function. Explaining that keeping blood sugars low through diet, exercise, and medication can slow the progression of the disease has been very powerful. We discussed that type 2 diabetes always progresses and insulin resistance inevitably turns into insulin deficiency. Once our bodies no longer make insulin, the disease is more difficult to regulate. It's well known that those that are dependent on exogenous insulin have a more difficult time controlling blood glucose levels. Lifestyle intervention is still crucial to the treatment of type 2 diabetes. Explaining that studies have shown that with weight loss and exercise, the damage to beta cells can be reversed. This reversibility, however, is limited, and after about 10 years duration of having type 2 diabetes, it's been found that the beta cell dysfunction becomes irreversible. So providers can identify people with prediabetes using one of the recommended blood tests. They can optimize EMRs to identify those with prediabetes or those that are at high risk. They can monitor patients with prediabetes annually to assess for progression towards type 2 diabetes and intervene when needed. Some providers may be uncomfortable labeling patients with the diagnosis of prediabetes, since we know that there are some that do not go on to develop the disease. But they can use codes for obesity and diabetes screening to get them the help they need. And most importantly, they can refer patients to a national diabetes prevention program and refer those with diabetes to a diabetes self management education program.